So I first wanted to talk to you about the winter season that we're in right now. How can one look after their health in winter?
Look, we really need people just to do all the simple things we've been talking about since the start of the pandemic. So I guess the first one is be up to date with your vaccines. And we know that's a bit of a confusing thing at the moment with eligibility increasing all the time. So the main thing there is have a chat to your GP or your pharmacist about whether you're eligible for another dose. And if you are, I'd strongly encourage getting it. I think then also if people have medical problems, we now have great therapies we can give them if they do test positive. But I think it's good if people have a chat to their GP or specialist before they get COVID as to whether they might be eligible for some treatment if they test positive. So then they can have a plan for how they get those tablets, because those tablets we have work really well at keeping people out of hospital if they're high risk and they test positive for COVID. And then it's all those really simple public health and social measures or basic hygiene measures, which are things like mask wearing. Masks are so important at the moment, protect you really well from COVID and the flu. Social distancing is a really good thing to remember at the moment as well. Hand hygiene, and also a bit of a focus on ventilation. So we know if there's good airflow, it's a little bit less easy for the virus to be transmitted. So if we look at all those things, and if we keep looking at all those things for at least the next few weeks, but maybe even the rest of this year, then that'll go a really long way to protecting yourself and people around you.
And let's talk about a little bit about the overlap between flu and COVID right now, because I know a lot of people might be getting one of each, one of both. So what are the symptoms that they need to look for to be able to differentiate which is which?
Look, you're right, that's causing a big challenge for us at the moment. And what's really clear is all our measures to protect people from COVID were really effective at keeping the flu away. And now that we've relaxed those, the flu's come back, but everyone's a bit more susceptible because no one's had the flu the last few years, and our flu vaccine rates have dropped. So we're seeing the flu cause more problems than it might normally. And if you add that to the COVID case numbers, then that's a huge burden on our healthcare system. So there's no symptoms that make us able to tell apart COVID or the flu, and that's why we need people to get tested. And the reason we want people to get tested is not only is it good to know which one people have, so we know how to tell them to isolate and those sort of things, but we have good therapies both for COVID and the flu. So simple message, if you have any symptoms that could be any infection, stay home and isolate either way and get a test. So we know if it's COVID, the flu or something else, and then we can give you the right management for whichever one it is.
Good advice there, thank you. And is it okay to get a flu vaccine and a COVID vaccine at the same time?
Oh, look, it's more than okay. It's actually encouraged. So people might remember early on we separated out those vaccines by a couple of weeks for a few reasons, but now we've got really good information that you can have your COVID and flu vaccine on the same day in different arms, and there's no greater risk of any side effects and no reduction in how either works. And so if you're someone who's not fully up to date with your COVID vaccines and not had your flu vaccine, then I definitely encourage getting both at the same time.
And we know that the flu vaccine has been around for some time now, but for some people this is the first time they're hearing about it. So why would you say the flu vaccine is so important, and how does it help you fight the flu?
Yeah, look, there's a bit of a renewed focus on vaccines at the moment as we're talking so much about the COVID vaccine, and so people are asking lots of good questions about the flu vaccine. And yeah, it's a vaccine that's been around for a very long time, and it works really well. A bit like how the COVID vaccine works, mostly in keeping people out of hospital, preventing people progressing to severe disease. So it doesn't stop everyone getting it. So people might say, oh, I had my vaccine and I still got the flu, so why would I get that? But what it does do is it stops you getting sicker. And so even though you might still get the flu, you'll get it much less severe than you would have had if you hadn't had your flu vaccine. And as our hospitals are full of COVID and flu patients, every person we can keep out by getting those vaccines makes a huge difference. So it's really important to get both vaccines this year.
Thank you so much. This is Dr. Paul Griffin, Director of Infectious Diseases at the Mater Hospital.
Thank you.